Good morning and welcome to the Health, Education, and Welfare Committee's budget hearings for the Department of Health. Today is August the 30th, 2023. The time is 10:02 a.m. So we're going to get started, and I would like to ask Representative Crawford for our invocation, if you could stand if you're able.
Another blessed day. Together to conduct business for our great nation. Pray that you guide us right.
Oh, Ms. Representative Crawford. Okay, we will now have the roll call by April Lindsay, Legislative Clerk.
Mary Crawford.
Present.
Joyce Deere.
Present.
Leonard Gouge.
Here.
Robert Huff.
Present.
Anna Marshall.
Present.
Madam Chair, you got 5 present and 0 absent.
5 present and 0 absent. A quorum is established and all business conducted will be official. We have no approval of minutes, so we will go on down to the order of business, and first is independent agencies, the election board. They have a revised budget, so that's why we are meeting with you today. Mr. Harjo, you have the floor.
Hey, good morning, Council.
Morning.
After we had our original hearing last week, I went back and was looking at my notes and looking over everything, and I did notice that there were a couple of discrepancies from what we had actually submitted to the hearing and what we actually got to see last week. The main difference being in our salary in the one position that was mentioned in particular about the achieving the educational goal. That total increase was not reflected in the last budget that you saw last week. And also on our licensings and software line, we were actually wanting to ask for $44,700, but I believe the amount that you saw last week was $42,000. So we actually shorted ourselves $2,700 from what we were actually needing. But that was the two main revisions, which increased our budget from what you saw last week from $939,843 to $964,880.
Can you repeat that total?
Oh, yes. What you should have saw last week was $939,843, but I don't have the 26% increase on mine copies of everything. I didn't receive that particular version of the budget, but what we are actually asking for today, our total would be $964,480. $964,880.
Our increase shows 960. The total is 967,731. I can't hear you. Okay, and it shows the budget was increased to 48,784.
Our what I've looked at and what I've my numbers come up to an increase of 45,933.
Okay, that's correct. Okay, thank you.
So the amended copy is not correct. So can you give us those changes again?
Madam Chair, may I comment, please?
Yes, I'm sorry, Ms. Barnett is on the line. You have a question or a comment? You have the floor.
Thank you. I just got a copy of this budget this morning and was able to review it. I'm wondering if the discrepancy, Nelson, on that final number, the total budget, the 964, is related to on Schedule A of the copy that I have in front of me. It has the registration specialist whose salary was increased is higher than the other registration specialists. And I don't know if that's making the difference or not in that total amount. But it might be something to verify. I don't have the other copy of what was presented.
No, that's not the discrepancy.
Okay.
If you do the numbers, the other positions, all have that 4% increase represented in the total, with the exception of the one position that got moved up to 39,605.
Madam Chair, I have a question.
Yes, Representative Marshall, you have the floor.
Well, maybe it's more of a concern than a question, because we approved your previous budget, correct? Okay. It was approved out of committee, and so we get this amended budget request, for changes because of the increases. And then the amended copy that we get is not the correct copy, and then we're changing our numbers. So can someone explain to me how that happened?
I cannot. I mean,
Okay.
I can only share what was presented to me. This is what the council's going to see. So that's
Okay.
what I'm bringing to you.
Oh, okay.
I had originally emailed to April, and I guess she just didn't get that one. And then I had emailed it to Nelson what he wanted it to say,
Oh, okay.
confirm.
So
and
there
that's
was
what
another
this
one that
is.
came out after this one?
I'm sorry.
There was another copy after this one? that
Yes,
we
because
received?
that one that you have in front of you still had the 4% raise added to the individual that he already bumped up for the school,
Okay.
and he didn't want that on there, so it brought it down even lower.
Oh, okay, okay. Thank you, Madam Chair. Thank you, Mr. Harjo.
Thank you, Representative Marshall. So these numbers are correct, and it decreased the budget rather than increased it. Thank you. Other questions for Mr. Harjo from the committee? Online or in attendance? Other questions from council online or in attendance? Hearing none, roll call vote, please. Need a motion, I'm sorry. Need a motion on the floor. When the committee is ready.
Madam Chair, I make a motion that we approve the amended budget request from the election board.
We have a motion on the floor from Representative Marshall to approve the amended or revised budget from the election board. Is there a second?
Second.
Second from Representative Crawford. Roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouge,
Yes.
Robert Huff,
Yes.
Mary Crawford.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The election board budget, the revised budget is approved. Thank you, Mr. Harjo. We're down to the Department of Health. Secretary Terry, you have the floor.
Good morning, Madam Chair. Thank you, committee.
Good morning.
I thought that I would start out by giving a little bit of an overview of why this budget looks on paper much different than what we've had in the years past. To start with, as you probably recall, we have had an ongoing legal fight with Indian Health Service on them paying us our full contract support cost. That's something that they have challenged us that they should not be supporting with contract support costs for our third-party dollars. And we've been advocating and filing legal disputes on that issue. The attorneys in our legal disputes have advised us that one of the things that we need to do is take all salaries within the Department of Health and move them into Indian Health Service funds. And as you recall, to try to keep things simple in the past, we budgeted all of the clinics under Indian Health Service and all of the hospitals under third party. And that way there was a clear line of where these facilities were being budgeted. And now all of employees throughout the Department of Health, they're either in Indian Health Service funds or in the indirect cost pool. So that's one of the biggest changes in why you're going to see multiple accounts across each facility that we look at today. The one of the other changes, you're going to see a direct budget in that we've created. As you know, there's an indirect cost budget. You're going to see a direct cost budget this year. And there are a number of employees that goes to support the clinics. And in an attempt to try to drive some of our indirect cost budget down, we have created this direct pool. And so you're going to see those changes as well. For some pay scale changes across the board, we did a 2% that applied to everyone. We then have made pay scale changes to pharmacists, pharmacy techs, and raised them up to the market this year. We raised LPNs, medical assistants, and certified nurse aides to compete with the market and brought them up to current market standards. We also brought IT and added more analysts into this budget. With providers, there was no base increase with with the providers this year. But one of the things we did do is if you were a provider and you had 5 and 10 and 15 and 20 years of experience, we did add a 5% increase across the board so that we started rewarding providers for their longevity here. And we don't think that it was fair to keep bringing physicians on at the same rate as some of our longer-term providers. So you're going to see that across the board. You're also going to see a budget for our 105L lease money that we have been applying for and receiving from Indian Health Service. That's a significant amount of money that's there. And with our third-party collections, we had projected $226 million last year, and our total budget for third-party, including the hotel at Council Oak and our direct cost allocation, we're going to have $227 million this year. So that's sort of the highlight of all of the big changes in the budget. And with that, I'm going to let Ms. Crawford go ahead and start off in your book. And I believe that behavioral health is at the top of the list.
Good morning.
Good morning, Ms. Crawford.
Okay, so behavioral health, we'll be looking at all the different funding sources for them. They have an IHS budget, third-party budget. They also have a small tribal budget. This is the $20,000 that's coming to them, which that's how much was in there this past year. We don't know how much the funding will be for that. So, but the minimum it's been is $20,000. And then we have 3 grants. These are the only grants we included in the budget are the ones that we've already had. We have a TR on. So any of the grants that are currently in the process for legislation are not included in this budget. I tried to make this a little bit simpler for the programs and clinics and hospitals that have both an IHS and a third party to put both of those on the same sheet because, as Mr. Terry explained, we shifted dollars into the salaries for IHS, which meant that their other expenses needed to be budgeted in a third-party budget. So if you just looked at a third party or an IHS, it looked like we were missing a lot of things. So that first column is the 23 budget for IHS, and the next column is 24. And all of these that have IHS and third party will be the same format. And then the third party last year and proposed budget for 24. So behavioral health, we have a total third-party budget, third-party and IHS budget in 24 of $6 million compared to 4.6 in 23. A lot of that has to do with increasing in the number of therapists that we need to see the patients, and then also a switch in moving more of the psychiatrist into taking care of children, and so allowing more hours of that rather than being split just between behavioral health and the HOPE unit. After that is the program activities, the 20,000, and then the 3 grants, SPIP, the 988 grant, that's the call center grant, and then BH2I, which is a grant that we had renewed this year. Any questions on behavioral health?
Are there questions from the committee for Ms. Crawford? Other questions from council online or in attendance?
Madam Chair, I have a question.
Yes, Representative Marshall.
Mr. Terry or Ms. Crawford, we purchased that property in Muskogee, the old St. Francis Hospital, and that will be renovated, I assume, and it'll be ready sometime. Will it be available in '24?
Yes. And so we have been preparing to present the council a budget that will come from the opioid settlement. And I believe the nation received its first distribution this month. And so we will have a meeting with the controller and talk about how we want to bring the National Council a budget for those opioid settlements. And we're hoping to do those renovations with those funds.
Okay. And then you talked about increasing some of your, was it behavioral health counselors or something? Okay. Is any of those positions that you're going to fill at the new behavioral health facility, are those included in this behavioral budget or not?
No.
So it'll be a separate budget?
It'll be a separate
Okay.
budget.
Okay.
There will be probably a few shifting. As you know, we have a few counselors that they may go to Okemah for a day, and then they may go to Wetumpka for a day, and that we may have some that shift around a little bit. But by and large, that's not what we've prepared.
Oh, okay. Okay. Thank you, Mr. Terry. Thank you, Ms. Crawford.
Thank you, Representative Marshall. Are there other questions from the committee? Questions from council in attendance or online? Hearing none, roll call vote, please.
I'll make a motion.
All right, I need a motion first.
Okay.
Trying to move along too fast.
Okay,
We have a
Madam
motion on
Chair.
the floor from Representative Marshall. Be passed.
I make a motion that we approve this budget
Behavioral health.
request.
We have a motion on the floor from Representative Marshall to approve this budget, behavioral health. The second from Representative Crawford. Any more discussion? Roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouge,
Yes.
Robert Huff,
Yes.
Mary Crawford.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The behavioral health budget is approved. We'll move on to the billing office.
Billing office comprises actually two departments. It's the revenue cycle and then the pharmacy billing. There was some increase in the direct assistance, so we use direct assistance dollars to purchase insurance for some of our patients that have really high pharmacy. That allows us to then have dollars to go further. There was some increase in personnel, and then because we'll be bringing the Council Oak Refill Center online in '24 as well, and then some increase in the contracts, just the software support cost.
Thank you, Ms. Crawford. Are there questions from the committee for Ms. Crawford on the billing office? Are there questions from council online or in attendance? Hearing none, I will entertain a motion when the committee is ready.
Make a motion to approve the billing office budget.
We have a motion on the floor from Representative Crawford to approve the billing office budget.
Second.
Second.
The second from Representative Marshall. Roll call vote, please.
Mary Crawford,
Yes.
Anna Marshall,
Yes.
Leonard Gouge,
Yes.
Robert Huff.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The billing office budget is approved. The next item is call center.
Thank you, Madam Chair. This is another new budget. I thought I would give just a brief introduction to. As you guys are aware, one of the things that we've consistently heard from representatives of the nation is that answering the phones are a big deal out here, and when people have a difficult time calling into the facilities and getting a hold of someone, and then that always turns into poor customer service and patient dissatisfaction. We created this call center this year so that way if any of our facilities, if someone doesn't answer the phone after just a few rings, it rolls over to this call center, and then the person at that call center then is instructed to get someone from that facility onto the phone with a warm handoff so that the patient is going to talk to an actual person during that time. I think that the first week we had thousands of phone calls that rolled over into the facility. It's something that we're continuing to try to perfect and work towards. But this is a new budget, and I'll let Ms. Crawford take it from here.
One of the things that you'll see on these budgets is you'll see a total line, and then you'll see an amount allocated. So for all of the direct cost new budgets, they're being allocated back to the clinics and the hospitals based on different allocation methods according to what it is. And one of the reasons for doing this is we need that cost in the clinics and the hospitals for our cost reports. So it's important that we get the cost in there. But for instance, to try to take the call center cost and allocate that on the general ledger on a monthly basis would be very difficult. So this is what you're going to see on several of these budgets is you'll see a total line, which is $3,011,000, and then the amount allocated out. The reason why there's a net amount here is this allocation was done before the change in the IDC. And so as we go through the year, the only thing that will actually be allocated is the actual expenses, not the budget. So if we come in under budget, then the clinics and hospitals will also have a smaller amount. I will say that in this budget, there's also some physician assistants and RNs because the plan is for them to be able to do triage calls and also do telemedicine visits. So as we have someone out in a clinic, or if we have patients that need to be seen and we can't get them in, then they could do telehealth visits through the call center as well. So that's part of that cost. And I'd be happy to answer any questions.
Are these call center
Pardon me?
Are these call center rep positions located at each clinic or each hospital?
No, they're currently located in the branch building, which is on the campus of Council Oak. That's where the call center has been created. But it's possible that those who do telehealth could do it from their home or from the clinic, yes.
Madam Chair, Robert Huft.
Yes, Representative Huft has a question. You have the floor.
Will this call center be open 24/7?
Thank you, Mr. Huff. Currently, it's not open 24/7. We hope that we're going to grow into that, and that we're going to continue to add professional services such as nursing. We could even potentially end up adding a mid-level practitioner that could do some telemedicine on site. But as we're growing and we get good at this, we absolutely hope that this turns into a 24/7 activity. But in this current budget, that's not where we are today.
I guess the reason why I asked that question is that you had so many call center representatives on here. That's the reason why I was asking that.
Yeah, I mean,
Positions.
it's frustrating for everyone. I mean, people don't just get sick from 8 to 5. That's why Council Oak has been successful in our urgent care activities on the weekends, and with telemedicine, it is going to give us a whole lot more options. So, we feel the pain that people are going through for that, and we're going to try to get there quickly.
Okay, thank you.
Thank you.
Thank you, Representative Huff. Are there other questions from the committee?
Yes.
Representative Marshall, you have the floor.
Thank you, Madam Chair. Mr. Terry, since it's not open 24/7, what are the hours?
Well, today it's 8 to 5, or maybe 7:30 to 5. We have it open during the day. We've been growing it. We had to launch it with 1 clinic, and then we launched it with 2, and then we launched it with 3. And so just as you know how sensitive phone systems are and they never work, that just getting each one of them to work, we've got thousands of phone lines and you have to have every phone line going to the right location. So it's really a logistical feat to try to pull this off, but so far they're all working 8 to 5 during the day.
And that's Monday through Friday, or is that on weekends as well?
Monday through Friday.
Okay. Well, I think it's really important that at least we started it, because I know that you're right, we do get a lot of complaints about it, and no one answers. So at least we know from 8 to 5, Monday through Friday, that there's someone that, when those phone lines roll over, there's somebody to answer. So thank you very much for doing that.
Thank you.
Hello, Representative Marshall. Are there other questions on this call center budget? Yes, Representative Crawford.
Mr. Terry, is the call center, is that working with these 3 employees?
I'm sorry?
The call center, I'm taking it that you just have the 3 employees for the call center?
I think there's... Yeah, I think that there's, I think whenever we first did the Schedule A for the budget, that we had 3, I think we're up to about 6 today.
And is that working out for the number of calls that you guys receive?
Yeah, it is, and once again, it's hit and miss. How people, we've had citizens that will answer the phones, and you'll have citizens say, "Well, I was calling Sepulpa Clinic. I wasn't calling you, and I wanted to talk to this person." So you're going to always have challenges how that's working out, and we're trying to make it appear as if you're calling Coweta that you think that Coweta is answering the phone. That's how we're hoping that it's ultimately going to be there. So we're perfecting it as we go, but by and large, we were missing hundreds of phone calls a day, and we're catching hundreds of phone calls a day. So they're talking to at least someone. So I consider that successful.
Thank you, Mr. Terry. Thank you, Madam Chair.
Thank you, Representative Crawford. Okay, it looks like on your proposed salary plan, you have 18 positions and 1 manager for the call center reps. Is that what you intend to have for next year? And will they all be located at Council Oak?
Yes. But some of those positions may actually be able to work from home and do telehealth.
Of the 18?
Yes, we're going to continue to grow that staffing, continue to maybe add a second shift. Yeah, so that full 18, whenever we get all of those 18 hired, that's when we will be able to go 24/7 with the service.
Thank you. Are there any other questions from the committee? Any questions from council online? Hearing none, roll call vote. I need a motion on the floor, please.
Madam Chair, I make a motion to approve.
Motion on the floor from Representative Gouge. Is there a second? Second by Representative.
Second, Robert Huff.
We have a second already from Representative Crawford. Roll call vote, please.
Senator Gouge,
Yes.
Robert Huff,
Yes.
Mary Crawford,
Yes.
Anna Marshall.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The call center budget is approved. Next budget is the clinic support.
Yeah. So the clinic support is another one of the direct cost allocations. There's basically 3 types of, we have our quality personnel that were previously in the budgets for the clinics and the hospitals. We moved them all to one department, the same with infection prevention. So neither one of these are new. We just moved them to this budget because it made it easier for to manage those costs if it's all in one cost center rather than in each individual clinic and hospital. The other positions in this budget are the nursing clinic. We have a nursing director for the clinic. So in the hospitals, you have a director of nurses. We're really missing that leadership in the clinics, and so we have someone who in this past year became the director who kind of coordinates with all of the nursing units in each clinic to make sure that everybody's kind of going along the same way. We have the same thing with pharmacists. So we have a pharmacist, which doesn't show up on the Schedule A because she's a commission core, but that pharmacist then coordinates with all of the pharmacists in the clinics. And so it just to bring some continuity to what we're doing in the clinics, to make sure everybody's on the same page. It's kind of became more important when we went with Epic.
I think one of the reasons why it became so important was when we switched over to the Epic electronic medical record. One of the things that has to happen is every nurse, every doctor, every pharmacist, every person that logs into Epic, they have to complete their charges inside the system every day, and they have to close out these accounts. And the way that you do that is extremely technical. And so this director of nursing is able to go from clinic to clinic and make sure that each one of our nurses at all of our facilities is doing that work inside the medical record so that we have a clean medical record there. So that's been some of the biggest activities for those roles. We're happy to answer any questions.
Are there questions from the committee for Mr. Terry or Ms. Crawford? Are there questions from council online? Hearing none, roll call vote, please. Right.
Madam
I need
Chair.
a motion on the floor.
Madam Chair.
Yes, Representative Marshall.
I make a motion that we approve the proposed salary plans and their budget for the clinic support program.
We have a motion on the floor from Representative Marshall to approve the clinic support budget. Is there a second? Second from Representative Crawford. Roll call vote, please.
Anna Marshall.
Yes.
Leonard Gouge.
Yes.
Robert Huff.
Yes.
Mary Crawford.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The clinic support budget is approved. The next item is how do you say that? COCH, Council Oak, Refill Center.
Yes, thank you, Madam Chair. As you guys may recall, I think I reported in HEW committee that we had earlier in the year a tornado get pretty close to our refill center, and that we felt like we needed to move forward with having some redundancy in the system. The refill center today is filling close to almost 4,000 prescriptions a day, and if something was to happen to there, we would have 4,000 citizens not getting their medications today. So we have moved forward with the planning of a new redundant refill center that will be located at Council Oak over in the branch building. And so that's going to be the changes that you see on here today. So half of the old refill center was budgeted in Indian Health Service dollars, and the new one will be taken straight out of third party. We're happy to answer any questions.
Where was it located at?
I'm sorry?
Was it located in a different area?
It is.
Was it at Coweta?
It was.
It was.
It
and now
is.
it will be.
Yes. It still is.
Oh,
It's going to still be there. This will have a second one
Okay.
that we're going to locate. So if Coweta ever goes down, we shouldn't feel the heat. It should just be able to pick straight back up. But as today, with the tribe's employee health insurance, you know that we can do refills through what we call the Riverwalk pharmacy refill. And so all of our employees get their medications through there. We're going to service all of the nation's employees through the new refill center. And then if Coweta ever goes down, we have a system to just bring it straight back up. So
Thank you, sir.
thank you.
Are there other questions from the committee? Are there questions from council online? Hearing none, roll call vote, please. Need a motion on the floor, I'm sorry.
Madam Chair, make that motion.
We have a motion on the floor from Representative Gouge. Is there a second?
Second.
Second from Representative Marshall. I'm sorry, Representative Crawford. Roll call vote, please.
Leonard Gouge,
Yes.
Robert Huff,
Yes.
Mary Crawford,
Yes.
Anna Marshall.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The Council Oak Refill Center budget is approved. The next item is contract health.
Okay, on the contract health this year, again, we have, the only thing in the IHS is the salaries and the direct assistants. You will see a decrease in the salaries. It's not because we decrease staff for contract health, but we have a grant called Money Follows the Person, and that we were able to move some of our staff into that grant because it's for contract health. So it's actually for getting them signed up on coverage, things like that. So some of the salary dollars went into that grant. We did have an increase in our direct assistance line for this year. That was really the only change. Do you have any other questions?
Other questions from the committee on this budget? I have one. Are all these positions located here in Okmulgee?
No, we have contract health staff in each one of the clinics.
They're all over the nation? Okay.
Yes.
Other questions from council online? I'm sorry, Representative Marshall has a question.
Since you've sort of revamped your contract health and they're located in the clinics, has that cut down on the turnaround time for people getting their referrals?
So for, I think, 80% of our patients, referrals should be approved on the same day. So we have seen a significant improvement in referral approval. So one of the complexities about referrals is when people are also on some type of managed Medicaid or Medicare or Social Security or disability or insurance, workers' comp or something. And those types of things will sometimes take a little longer, or depending on what specialties are out there. But for, I think, 80%, we see almost a same-day approval now.
So since there's same-day approval, is it then, based on what you said about the Medicare and the Medicaid and some of the other special circumstances, then is it difficult for you to find the providers to be able to see those particular patients or not?
Well, it depends on what specialty it is. There's almost no dermatology availability that's out there. It takes us months to find dermatology. There's some pediatric specialties that have to go all the way to Oklahoma City. OU has some of the pediatric specialties. We see that endocrinology, there's a huge shortage of. As you guys may recall, we hired our own endocrinologist this year, and so we've been able to improve some of that. But there is still, in the Tulsa market, it's getting harder and harder to access specialties for sure.
Because I had one citizen couldn't understand why, and I guess she went to Wewoka Clinic, and she was being sent because of a rotor cuff or something. So she was going to Shawnee for one appointment, then she was being sent to the rehab center where the old George Nye was. So she was going there for something else, and then they referred her to Tulsa. So she asked me, she goes, I don't have that kind of gas money to be traveling all over the state of Oklahoma for this shoulder. So in situations like that, is it because it's a referral from Wewoka, or is it just the fact that her situation?
You know, as you know, and we've had several calls from you and others about Wewoka, and to the point that we had a meeting with their leadership about 2 weeks ago. It was a very good phone call. And what it really boiled down to was communication between Wewoka and us. And we have started communicating much better between our two organizations on how those referrals should go. And so I think that you're going to keep seeing that getting and improving.
Oh, okay. Okay. Well, I'll relay that back to the citizens. So thank you very much.
Thank you.
Thank you, Madam Chair.
Thank you, Representative Marshall. Are there other questions from the committee? Are there any questions from council online?
Yes, Madam Chair, this is Representative Harjo.
Yes, Representative Harjo, you have the floor.
I just kind of want to, make some of the same statements or have some of the same sentiments that Ann had because I think one of the things that I've recognized and have been asked a lot about, these situations. I understand that, Council Oak is a good place for us, but, the biggest factor that we have is that's our hospital, but we also have the hospital in Okemah. We also have the hospital in Okmulgee. And unfortunately, our people, we still have people out there on fixed incomes and they can't follow the money. As good as our facilities may be in Tulsa, we have these other facilities I think we need to be utilizing just a little bit more too, for other services because unfortunately our people can't follow the money. And we got a lot of older people who are on those fixed incomes. So I think we need to kind of look at and be cognizant of all those folks, so that way we can get a lot of the other services further down south. Because if we don't, well then it kind of begs to me that there was no reason for us to have a new hospital and these other facilities if we're not going to use them, such as because our people just can't really afford that. The money goes up to Tulsa quite a bit, but our citizens, we got a bunch of them down south too. So, thank you, Madam Chair.
Thank you, Representative Harjo.
Yeah, thank you, Mr. Harjo. Following the money is a technical term, and what that meant was that if we had patients that went to Cherokee Nation, then that money, what we want the money to do is if one of our citizens goes to Cherokee Nation or one of the Cherokee patients comes to ours, we want that money to follow where it goes. So it's not by the hospital or our patients following inside of our facilities. Our facilities the money doesn't follow the person. What follow the money is really a technical term going between tribes. So if one of our citizens goes to Cherokee, we want that money to follow that patient, and if vice versa. So that way, because what happens is this really started for us whenever we took over Okmulgee Hospital. In Okmulgee, we had an MRI machine, and no one else had an MRI machine. And so other tribes would refer patients over to Okmulgee, and it would fill up our MRI. Our citizens couldn't get in to get an MRI because it was full, and we wouldn't be getting paid for it. And so that's really where the follow the money started, is we wanted to get paid for those tribal citizens who other tribes were referring over to us. And we absolutely agree with Mr. Harjo's sentiment. This year we're going to have prenatal clinics going to Okemah. We've started cardiology clinics in Okemah and Okmulgee. We hired another gastroenterologist to go to Okemah a couple of days a week. So we absolutely agree with, we try to keep those patients as close to home as we can and continue to do that. So I appreciate those statements.
Thank you, Secretary
Madam
Terry.
Chair,
Yes, Representative.
Representative Harjo.
Yes.
Yeah, and I understand, Mr. Terry, that, you know, I know that's a technical term, but in my reference to this particular thing is that our people couldn't follow where our own dollars were being put throughout our reservation. Because I'm not speaking in terms of going to Cherokee Nation or any other place, but I'm saying if we're wanting to put them in our facilities, well then, you know, we transfer somebody from, you know, Ophusky or Hughes County up to Tulsa, and all of a sudden, some of the family members may not be able to travel that far. And so that's how come I'm saying, you know, we have hospitals. We had a branded hospital we built, and I could almost see them as, you know, handling things that might not be as quite as acute as what the facilities in Tulsa would handle, and it would make it much easier for our people to travel to be with their loved ones, and it would make it much easier for those who may be able to get services provided at these other hospitals we have built. But when I'm speaking in terms of following the money, our people can't follow the money to where majority of it's being sent to in Tulsa. They can't travel clear across the reservation sometimes because it's very costly for them. And so it's not a matter of being transferred outside of our reservation. I'm just speaking in terms of our reservation. Our people sometimes don't have the money to follow that particular money to where we're devoting all the better services to where they have to go to it. Thank you, sir. Thank you, Madam Chair.
Thank you, Representative Harjo.
Thank you, Mr. Harjo. Always happy to engage in those conversations, and I couldn't agree with you more.
Are there other questions from the committee? Other questions from council online?
Madam Chair,
Yes, Representative Marshall.
if you're ready to entertain a motion, I make a motion that we approve the contract health.
Yes, we have a motion on the floor from Representative Marshall to approve the contract health budget. Is there a second? Second from Representative Crawford. Roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouge,
Yes.
Robert Huff,
Yes.
Mary Crawford.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The contract health budget is approved. We will move on next to the Council Oak Comprehensive Health Budget.
This budget is for the employee pharmacy. So this is the pharmacy that Mr. Terry was referring to. It's located at Council Oak, but it serves the pharmacy needs for both all that are on, I guess.
We're happy to answer any questions.
Other questions from the committee? on this budget. Council Oak Comprehensive Health Branch, which is the employee pharmacy. Other questions from council online? Hearing none, when the committee is ready, I will entertain a motion.
Madam Chair, I make that motion, Robert Huft.
Do we have a motion on the floor from Representative Huft to approve this budget? Is there a second?
Second.
Second from Representative Gouge. Roll call vote, please.
Robert Huff,
Yes. Excuse me, yes.
Mary Crawford,
Yes.
Anna Marshall,
Yes.
Leonard Gouge.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The Council Oak Comprehensive Health Branch budget is approved. Next budget is the Council Oak Comprehensive Health Clinic budget.
So the major difference in this budget, and we did have a clinic budget last year, but we're adding more services, including optometry. We recently added a pediatrician. So really, it's more an increase in the number of and types of clinics that we'll have at Council Oak. I'd be happy to answer any questions.
Other questions from the committee on this budget? Yes, Representative Crawford.
Mr. Terry, do you all have any of the nurses that go out to do teaching to some of the citizens, especially like the diabetes?
We do have public health nurses that go out if they receive a referral to do that. We also have a contract with with Sooner Home Health, and we have worked out a day rate agreement so that if we have a citizen that's at home and we need somebody to go out and check on them and do a medical visit, that I can call that home health service and they'll just bill us directly for that. So that's the 2 primary ways we can go do a home visit.
Thank you.
Thank you, Representative Crawford. Are there other questions from the committee? In the committee online? Are there questions from the representatives online? Hearing none, when the committee... Yes, Representative Golden.
Yes, thank you. When you, Mr. Terry, when you say that home health, you can go do a visit, is that only one visit? It's not something that you do like 2 visits a week for someone like an elderly person who's disabled?
Ms. Golden, could you repeat that?
Ms.
We couldn't
Golden,
hear you.
you're breaking up just a little bit inside of here. I didn't catch all of your question.
Okay, I was asking on when you mentioned home visit, if someone needed one, that a home health, you could send someone over there. And I was asking if that's a one-time thing, or is it something that you can do for patients like twice a week for 2 weeks or twice a week for a month?
We've worked out a day rate, and they go out and the nurse does an initial assessment, and then they bring us a treatment plan. So if that's a 1-day or a 3-day or a 5-day, they run the treatment plan through us, and then we approve that treatment plan, and we just pay them a day rate, no matter how long that takes. So it's we do have the options for multiple visits.
Thank you, sir. Thank you, Madam Chair.
Thank you, Representative Golden. Are there other questions from the council online? Hearing none, when the committee is ready, I will entertain a motion.
Madam Chair, I make a
Yes.
motion that we approve the Council Oak Comprehensive Health Clinic
We have a motion on the floor from Representative Marshall to approve this budget. Is there a second? Second from Representative Crawford. Roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouch,
Yes.
Robert Huff,
Yes.
Mary Crawford.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The Council Oak Comprehensive Health Clinic is approved. Budget is approved. We are down to the Council Oak Comprehensive Health Hospital.
Thank you. This budget is broken out, and there's two pieces to this. There's a third-party budget, which is the operations of the hospital, and then there's a 105L lease. So we have 105L lease money that comes for Council Oak. What you're seeing here, the $840,000, is just the interest that's expected to be on the amount that was borrowed for that. The rest of the money will be applied to the amount that we owe. So that's just a reduction in liability, so that's why it's not budgeted in the an expense budget. So we are, I believe we should be able to pay that one off by the end of '26, based on the funds that we're receiving yearly for that 105. The big difference on the hospital this year is it is fully opened. So where we had some services last year kind of staggered through part of not knowing that it wasn't all going to open up at the same time, this budget reflects a full year with surgery open and the medical surgical floor and ICU all open. So I'd be happy to answer any questions.
Are there questions from the committee on this budget? Yes, Representative Crawford.
Mr. Terry, has the surgical suite opened at Council Oak?
2 weeks. It will be open in 2 weeks. So I walked through yesterday. They had every room fully stocked. We've had one initial clean. 3 of the surgeons came through yesterday. The schedule has been booked, started getting booked for surgery. Next week, we'll do one additional terminal clean. And once we do that terminal clean, then there won't be any other people allowed back behind that line unless they're fully suited up to clean. And then we'll go live the next week.
And how many rooms do we have?
So there's 3 large surgical suites. The OR number 1, which has our Da Vinci robot unit sitting inside there. Then there's 2 other large ones. Then there's a small procedure room. We have a bronchoscopy room where we'll do various pulmonary procedures, and then 2 endoscopy suites. And so we'll have 2 endoscopy rooms switching back and forth. So there's a total of about 7 total suites back there.
Thank you,
Thank you.
Madam Chair.
Thank you, Representative Crawford. Are there other questions on this budget? Are there questions from committee online? Are there questions from council online? Hearing none, when the committee is ready, I will entertain a motion.
Madam Chair, I make a motion that we approve the Council Oak Health Hospital budget.
We have a motion on the floor for approval of this budget. Is there a second?
Second.
Second from Representative Crawford. Roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouch,
Yes.
Robert Huff,
Yes.
Mary Crawford.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The Council Oak Comprehensive Health Hospital budget is approved. That's a mouthful to say. Next budget is the Employee Health Clinic budget.
There's very little difference in this budget. This This is the employee health clinic that's located across from the Medical Center Hospital. I'd be happy to answer any questions on it.
Other questions for Ms. Crawford on this budget? Other questions from committee online? Other questions from council online? Ms. Crawford? Hearing none, when the committee is ready, I will entertain a motion.
Madam Chair, I make the motion.
A motion on the floor from Representative Gouge for approval of this budget,
Second, Robert Huft.
second by Representative Huft. Roll call vote, please.
Leonard Gouge,
Yes.
Robert Huff,
Yes.
Mary Crawford,
Yes.
Anna Marshall.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The employee health clinic budget is approved. We're now at the Eufaula Clinic budget.
Okay, on the Eufaula Clinic, and it's going to be pretty much for all of the clinics. There, we do have some pay increases which were reflected, for the, Mr. Terry talked about at the beginning, the dental assistants, the CNAs, MAs, LPNs, and then the pharmacy and pharmacy techs all affect these budgets quite a bit. We also have had an increase. We increased our drug cost budgets. We found that we needed to increase on all of these just due to the number of scripts that were being written. There's also a little bit of an increase in our lab fees. This is the lab that's not only the cost of the labs that we have in the clinics, but also the labs that are being sent out to LabCorp. And I'd be happy to answer any questions on the Eufaula Clinic budget.
Thank you, Ms. Crawford. Are there questions from the committee for Ms. Crawford on this budget? Questions from committee online? Questions from council online? Hearing none, when the committee is ready, I will entertain a motion.
Madam Chair, I make a motion that we approve the Eufaula Clinic budget.
We have a motion on the floor to approve this budget. Is there a second? Second from Representative Marshall. Sorry, Representative Crawford. Roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouge,
Yes.
Robert Huff,
Yes.
Mary Crawford.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The Eufaula Clinic budget is approved. The next budget is facilities management.
Facilities management has 3 budgets. They have an IHS budget, which is their salaries, then the third party, and then the 105L lease. The third party, as you'll see, there's money in renovations. We have seen an increase in our insurance expense, and then the renovation cost, renovation repairs. We did budget the 105L lease money for all of the facilities with the exception of Okemah and Council Oak in facilities under renovations because all of those facilities are completely paid for. Okemah Hospital and Council Oak were using that 105L lease money to pay down what is owed on those facilities. But all of the other facilities, Medical Center, PRC building, all of our clinics, we budgeted all of that into the renovations line because there is a lot of work to do on these older buildings. And I'd be happy to answer any questions. We did add some additional staffing for facilities management just due to adding Council Oak and also the expectation for Ms. Skogie. Even though it will be a while before that will be open, they need someone on site overseeing that renovation project.
Other questions from the committee for Ms. Crawford on this budget? Questions from committee online or council online? Hearing none, when the committee is ready, I will entertain a motion.
Madam Chair, make the motion. Robert Huft.
We have a motion on the floor from Representative Huff to approve this budget. Is there a second? Seconded by Representative Crawford. Roll call vote, please.
Robert Huff,
Yes.
Mary Crawford, Anna Marshall,
Yes.
Leonard Gouch.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The facilities management budget is approved. The next budget is the health information management budget.
Okay, this is our IT budget. We have indirect, and then we have the third-party allocation. So the indirect portion is the salaries for all of the IT personnel from network, security, systems, Epic analyst, all of that personnel that's required for that system. And then the third-party allocation is another one of those direct costs where we're allocating the cost of the Epic system, a lot of the third-party interfaces that are involved with Epic, we're allocating that out to the hospitals and clinics. We do have some cost for travel, software, and so forth that's not directly allocated because it's for the entire Department of Health, and so that's included in the $20 million as well. And I'd be happy to answer any questions.
Thank you, Ms. Crawford. Are there questions on this budget from the committee for Ms. Crawford? Are there questions from the committee online? Are there questions from the council online? Hearing none, when the committee is ready, I will entertain a motion.
Madam Chair, I make a motion that we approve the health information management budget.
We have a motion on the floor from Representative Marshall to approve this budget. Is there a second? Seconded by Representative Crawford. Roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouch,
Yes.
Robert Huff,
Yes.
Mary Crawford.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The health information management budget is approved. Next item is the hotel.
Thank you, Madam Chair.
Council Oak. It's Council Oak
This
Hotel.
is the Council Oak Hotel. We have put now 50 hotel rooms into operation. All of those rooms have new flooring, new paint, new ceiling tile. We've upgraded some of the bathroom fixtures that needed to be fixed. And we have a manager that is managing that on a daily basis. And with that, we're happy to answer any questions.
Thank you, Mr. Terry. Are there questions for Mr. Terry on this budget? And thank you for clarification of that.
Madam Chair, I have a question.
Yes, Representative Marshall.
So you've opened up the hotel now officially. Are you busy? I mean, are those rooms being filled?
They haven't been busy yet. As we're growing the inpatient, that's really going to be for those families that have someone in inpatient. I think that once we get surgery going in 2 weeks, we're going to have people spending the night before surgery, and that's going to be another big use of that hotel. And then there's going to be people that's really not ready to go home after surgery, and they don't have anyone to take care of them, and they can stay there at the hotel. So I think that in the next couple of weeks, we're going to start seeing it get a lot busier.
Thank you, Mr. Terry. Thank you, Madam Chair.
Thank you, Representative Marshall. Mr. Terry, is that located in the Council Oak Hospital?
It is. It's on the third floor
Third floor.
of Council Oak.
Thank you. Are there other questions for Mr. Terry or Ms. Crawford?
Madam Chair, I would also like to point out that this is not just for patients that are at Council Oak. If any of our citizens, their families are staying at, if their families in St. Francis or St. John's or Hillcrest or OSU, they can also come over and use that hotel for a medical stay if their family's in Tulsa as well.
Thank you. Thank you for that explanation. Questions? Are there other questions from the committee?
Madam Chair, I make a motion to approve.
Yes, Representative Gouge has made a motion to approve this budget.
Second, Robert Huft.
Second by Representative Huft. Roll call vote, please.
Leonard Gouge,
Yes.
Robert Huff,
Yes.
Mary Crawford,
Yes.
Anna Marshall.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The Council Oak Hotel budget is approved. Now we're at the Coweta Clinic.
Yeah. The Coweta Clinic is much like Eufaula. There's an IHS budget, which is for all of the salaries, and then everything else is in a third-party budget. So again, we had to increase for the pharmacy drug cost. There was some, the increases that we made in the pay scales affected the clinic quite a bit as well. Be happy to answer any questions regarding the Coweta Clinic.
Are there questions from the committee for Ms. Crawford on this budget? Coweta Clinic. Are there questions from council online? Hearing none, when the committee is ready, I will entertain a motion.
Madam Chair,
Yes, Representative Marshall.
I make a motion that we approve the Coweta Clinic budget.
We have a motion on the floor from Representative Marshall to approve this budget. Is there a second? Second from Representative Crawford. Roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouge,
Yes.
Robert Huff,
Yes.
Mary Crawford.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The Coweta Clinic budget is approved. We are down to the long-term acute care hospital.
This budget looks a little bit different because many of the services for the LTAC are being provided by the medical center. So we are actually moving costs from the medical center to the LTAC because we need to properly allocate for those costs. So for instance, the lab, we don't have a separate lab for the LTAC because it's located in the medical center. So they basically purchase those services from the medical center. So you see a line on their budget, it's $2.1 million. That's for the cost of those services that they will receive from the medical center in 2024. And I'll be happy to answer any questions.
Other questions at this time from the committee for Ms. Crawford? Other questions from council online? When the committee is ready, I will entertain a motion.
Madam Chair, I make that motion, Robert Huft.
Representative Huft has made a motion to approve this budget. Is there a second? Second, Representative Gouge.
Yes.
We have a motion on the floor and a second. Roll call vote, please.
Robert Huff,
Yes.
Mary Crawford,
Yes.
Anna Marshall,
Yes.
Leonard Gouch.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The LTAC budget is approved. We are down to the Muskogee Creek Nation Refill Center.
Okay, this is the refill center that's located in Coweta. And really the only difference in this budget for this year is that we reduced some of the drug cost for this budget because of bringing Council Oak online. So there was a slight decrease in this budget, but that's all. I'd be happy to answer any questions.
Are there questions from the committee for Ms. Crawford on this budget? Are there questions from council online? When the committee is ready, I will entertain a motion.
Madam Chair, I make a
Madam
motion.
Chair, I make the motion.
We have a motion on the floor from Representative Marshall to approve this budget. Is there a second?
Second.
Seconded
Robert
by-
Huft.
Seconded by Representative Huft. Roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouch,
Yes.
Robert Huff,
Yes.
Mary Crawford.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The Muskogee Creek Nation Refill Center budget is approved. We are down to the medical services budget.
Okay, this is the CMO's office. So again, very little change in this budget. Other than moving, this one was already, all the salaries were in IHS. So there's no big change in this budget. But we did move their other expenses into third party. To answer any questions.
Thank you, Ms. Crawford. Are there questions from the committee for Ms. Crawford on this budget? Are there questions from council online on this budget? When the committee is ready, I will entertain a motion.
Madam Chair.
Yes, Representative Crawford.
Move. Medical services.
We have a motion on the floor to approve this budget. Is there a second?
Second.
Second, Robert Huft.
Second by Representative Marshall. Roll call vote, please.
Mary Crawford, Anna Marshall,
Yes.
Leonard Gouch,
Yes.
Robert Huff.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The medical services budget is approved. We're down to the Okema Hospital.
Okema Clinic.
Okema Clinic.
Right, Okema Clinic.
Do you have it, clinic next? There's this clinic budget is much like the others, was affected by the increases in the pay scales. We do have a third-party budget for their other expenses, but all of the salaries are in IHS.
When we went over the Eufaula Clinic, and you said they were pretty much the same. The clinic
Yes.
budgets were pretty much the
Right.
same.
The changes that affected all of the clinics, really, the dental, the pharmacy, and then the LPNs, MAs, and CNAs, because they do have a lot of that staff. So those changes in the pay scales did affect all of those
Thank you.
budgets.
Thank you, Ms. Crawford.
Yes, we did add a provider at Okema as well. Thank you. And I'd be happy to answer any questions.
Other questions from the committee for Ms. Crawford on this budget? Other questions from council online? Hearing none, when the committee is ready, I will entertain a motion.
Madam Chair,
Yes, Representative Marshall.
I make a motion that we approve the Okema Clinic budget.
Motion on the floor to approve this budget. Is there a second? Second from Representative Crawford. Roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouge,
Yes.
Robert Huff,
Yes.
Mary Crawford.
Yes.
Madam Chair, you got 4 in favor and 0 against.
We have 4 in favor and 0 against. The clinic budget is approved. We're down to Okema Hospital budget.
Yes. So the Okema Hospital has 3 budgets. They have an IHS. We were able to put all of the salaries for the hospital and EMS into IHS. And then the third party is all of their other expenses. And again, on this one, we have a 105L lease to pay the interest expense on the Okema loan. The balance of what we receive in the 105L lease goes against paying the principal and reducing that amount. Don't have any other real changes on this budget. I'd be happy to answer any questions.
Other questions from the committee on this budget?
Madam Chair, I have a question.
Yes, Representative Marshall.
Ms. Crawford, you mentioned that there was a loan.
Yes, ma'am.
Okay. And how much longer will it be before that loan is paid off? Oh, no.
I believe that was a 20-year loan that was arranged by Mr. Darnell 2 years ago.
Oh, okay.
It was originally with BOK, and it's actually a loan that we paid to the tribe.
Oh, okay, okay.
Yeah, so they structured that loan at the tribe when they built the Okema Hospital.
Okay.
And just up until a couple of years ago, the tribe was supporting that loan and they were paying those fees. And then we've been working with the office, the principal chief's office and the controller, and we've now assumed all the payments of Eufaula and Okema loans for all that construction and for all of our facilities. So we're about to the point where we're almost out of debt to the tribe for those original loans, and we're making all of those payments now. So
okay.
that's what we've been trying to achieve.
Okay. Okay, thank you, Mr. Terry. Thank you, Ms. Crawford, for that clarification, and thank you, Madam Chair.
Thank you, Representative Marshall. Are there other questions from the committee? Other questions? Everybody.
Well.
Everybody still on? We had a technical glitch just now. Representative Gouge, are you on?
Yes.
Representative Huft?
Yes.
Okay, thank you. We're back on.
Madam Chair,
Yes, Representative Marshall.
if you're ready to entertain a motion, I make a motion that we approve the Okema Hospital budget.
Okay, we have a motion on the floor from Representative Marshall to approve the Okema Hospital budget. Is there a
Second, Robert Huft.
Second by Representative Huft. Roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouch,
Yes.
Robert Huff,
Yes.
Mary Crawford.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The Okema Hospital budget is approved. We are now at the Okmulgee Clinic.
Again, this is many of the same changes that we talked about for the other clinics. We do have budgeted for a dentist to add to Okmulgee Clinic and a pharmacist because we had, due to the number of scripts that they have there, so. Happy to answer any other questions.
Thank you, Ms. Crawford. Are there questions from the committee for Ms. Crawford on this budget? Yes, Representative Crawford.
Mr. Terry, do we have any, do we do dentures for our citizens?
Yes, we have the denture program out of Coweta. And when we assumed the money from WeWoka, we didn't want our citizens to have to drive all the way to Coweta to go get dentures. So we've been contracting with dental operations in Shawnee, Norman, Holdenville, in that area, trying to get contracts so that the people down there can go to a local dentist for their dentures down there.
I had a citizen was notified, and she called and said that she went ahead and had her lower teeth removed. Now she's having trouble trying to find someone to supply her with her dentures.
I think I was notified of the same issue, and I think that we asked Dr. Cook, our dental director, to get in contact with her and make sure. And so I know I think we got her taken care of.
Thank you. Thank you, Madam Chair.
Thank you, Representative Crawford. Are there other questions from the committee? Are there any questions from council online? Hearing none, when the committee is ready, I will entertain a motion.
I make that motion, Robert Huff.
We have a motion on the floor from Representative Huff to approve this budget. Is there a second?
Second.
Second by Representative Gouch. Roll call vote, please.
Robert Huff,
Yes.
Mary Crawford,
Yes.
Anna Marshall,
Yes.
Leonard Gouch.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The Okmulgee Clinic budget is approved. Now it's the Okmulgee Medical Center budget.
This budget, we do have an increase of a nurse practitioner that will be half-time on the HOPE unit and half-time in behavioral health to help with the additional load that behavioral health has. There's also some increase in the OR because we are doing more surgeries at Medical Center now. So we found that as we moved them down there waiting for Council Oak to open, that we could handle more of the surgery. So we'll be doing surgeries in both places other than just the endo in general.
Just another quick point to that nurse practitioner that's going to be working on the HOPE unit. There is, I believe, 3 board certified child psychiatrists in Oklahoma. We have one of them, Dr. Pauls, and he spends half of his time in the mornings on the Hope unit, helping take care of that geropsych. We know that we have more pediatric and adolescent psych issues than we can handle. And so that's why we've also added this nurse practitioner so that we can free up Dr. Pauls just to focus his time on adolescents and children's psych because there's such a backlog of it. And this nurse practitioner will handle what a lot of his responsibilities in the hospital are today. So just another little point there.
Thank you, Mr. Terry. Are there any questions from the committee on this budget? Any questions from council online? Hearing none, when the committee is ready, I will entertain a motion.
Madam Chair, I make the motion, Robert Huft.
We have a motion on the floor from Representative Huff to approve this budget. Is there a second?
Second.
We have a second from Representative Marshall. Roll call vote, please.
Robert Huff,
Yes.
Mary Crawford,
Yes.
Anna Marshall,
Yes.
Leonard Gouch.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The Mulgi Medical Center budget is approved.
Sometimes I type an acronym, it doesn't.
Okay, we are at the pain clinic budget.
Madam Chair,
Yes, Secretary Terry.
could we potentially request a 5-minute break and let us take care of things?
Yes, thank you for that suggestion. We will have a 10-minute break. The time now is 11:40, and we will come back in 10 minutes. Thank you, sir. All right, we are back in session. The Health, Education, and Welfare budget. We were on the pain clinic budget, starting to do that before we took a break. We will start there.
The pain clinic is made up of two grants. It's the MAT grant and the TOR grant. Both of those grants we've had for several years. Just budgeted at the grant amount, but I'd be happy to answer any questions.
Other questions for Ms. Crawford on this budget from the committee?
Madam Chair, I have a question.
Yes, Representative Marshall.
Where is the pain clinic in all the clinics, or is it in just one location?
It's in Okmulgee.
It's in Okmulgee?
We do have TOR and MAT staff at Council Oak. Like Dr. Reed sees some patients that are under the pain, but primarily the pain clinic itself is Dr. Bolnick, and that's in Okmulgee.
Okay. Is the pain clinic, is it because you don't want to put them on drugs to manage the pain, or?
So when we started the fight with opioid addiction, the primary reason why patients were put on opioids was because of pain. And so what the pain clinic does, and it has a board-certified anesthesiologist here that manages that pain. And so the goal is try to get them off of opiates. And they use a variety of things. They try to put them on various different types of medications. We use physical therapy, we use chiropractic, we use we used aquatherapy. We've had a multitude of therapies trying to get patients off of those dangerous opiates. And so he manages that clinic in Okmulgee. We have one of the things that patients are required to do is that they have to regularly get their labs checked, so to see how their kidney functions are doing and all of those things. So they can go to any of their local clinics to get those labs done. They can go to physical therapy at any of the locations. They can use our chiropractors at any of our locations. So it's really a multidisciplinary approach to pain, but that we've centralized him in Okmulgee as our primary pain center, and we are already in discussions with adding that service to Muskogee when it's up and going as well.
Okay. I have another, well, no, that's okay. Thank you, Madam Chair. Thank you, Mr. Terry.
Thank you, Representative Marshall. Are there other questions from the committee? Are there questions from council online? Hearing none, when the committee is ready, I will entertain a motion.
Madam Chair, I make a motion that we pass the budget for the pain clinic.
We have a motion on the floor from Representative Marshall. Is there a second? Second by Representative Crawford. Roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouge,
Yes.
Robert Huff,
Yes.
Mary Crawford. Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The budget for the pain clinic is approved. Looking at the list, and the next item is the pink party
Yay,
budget.
we get to a party budget. So we did increase this budget slightly from last year, just increase in cost of the party, but it's pretty much the same as it was last year. October 16th is the date for the pink party.
November the 16th.
River Spirit, yes.
What was the date again?
October the 16th.
Okay.
at River Spirit. Are there any other questions?
Other questions from the committee for Ms. Crawford on this budget? Other questions from council online? Hearing none, I will entertain a motion when the committee is ready.
Madam Chair, make a motion to approve.
Motion on the floor from Representative Gouge. Is there a second?
Second.
Seconded by Representative Huft. Roll call vote, please.
Leonard Gouge,
Yes.
Robert Huff,
Yes.
Mary Crawford, Anna Marshall.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The budget for the Pink Party is approved. We are down to the public health budget.
Last year was the first year for the separate public health budget. This year, we moved all the public health nurses that were in the clinic budgets under public health, just to make it a little more easier for those to be directed as far as their services. Abby Lee is now the director of the public health program, and she is currently working to fill those positions that we have in the Schedule A. Happy to entertain any questions regarding public health.
Madam Chair, just maybe a couple of other additional comments. One of the things that we're doing with public health is that we're going through an accreditation process, and that we hope that, well, maybe in HEW, one of the things you've heard me talk about is the social determinants of health, that you have patients that if they're having problems with rent, they're probably not real focused on their diabetes care. And if they're having problems with utilities problems, or they have abuse problems, that they're not real focused maybe on taking their medications and coming to their clinic appointments and all of those things. So what we're doing with public health and accreditation is we're trying to bridge all the programs inside of the nation. So we have housing and community services and veterans affairs and all of that they will meet quarterly to see how if we have a citizen that's in that comes into the clinic and they identify that they have a housing issue, then we can have a case manager start to work with housing on fixing that situation. Or if they have a problem with domestic abuse, we can work with them on that situation. And so hopefully we're going to get to the point where our citizens don't feel like that the right hand and the left hand doesn't know what the other one's talking about. And so we really want to look at how we can be better as a nation, that when a citizen identifies a problem, no matter where you are, that we're able to address that. So that's some of the goals that we have with this public health department, and I'm happy to answer any questions if you have any.
Thank you, Mr. Terry. Are there questions for Mr. Terry from the committee? Other questions from council online? Hearing none, when the committee is ready, I will entertain a motion.
Madam Chair, I make a motion that we approve the public health budget.
We have a motion on the floor from Representative Marshall to approve this budget. Is there a second? Second from Representative Crawford. Roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouge,
Yes.
Robert Huff,
Yes.
Mary Crawford. Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The public health budget is approved. On to the Sapulpa Clinic budget.
Sapulpa Clinic budget, again, is one that has the IHS for all of the salaries and third party for all of the other expenses. Again, this is another one that was affected by the pay scale changes, our drug cost, and lab fees. And I'd be happy to entertain any questions.
Thank you, Ms. Crawford. Are there questions from the committee for Ms. Crawford on the health budget? I'm sorry, the Sapulpa Clinic budget. Are there questions from council online? Hearing none, when the committee is ready, I will entertain a motion.
Madam Chair,
Yes, Representative Marshall.
I make a motion to approve the Sapulpa Clinic budget.
We have a motion on the floor from Representative Marshall to approve this budget. Is there a second? Second from Representative Crawford. Roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouch,
Yes.
Robert Huff,
Yes.
Mary Crawford. Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The Sapulpa Clinic budget is approved. We are down to the Secretary of Health budget.
This budget has an indirect budget, a third-party budget, and a third-party allocation budget. What we have included in indirect and third-party are just what we have always included in those budgets, so there's really no change in what we're budgeting in those individually. We do have in the third-party budget some carryover. We have not budgeted carryover funds in the last several years. Those funds are used to buy equipment, primarily anything that's over $5,000. We don't budget equipment in the hospitals and clinic budgets. So those all go to a capital committee that approves those purchases, and then we use those carryover funds for that. And I'd be happy to answer any questions.
Thank you, Ms. Crawford. Are there questions from the committee on this budget? I have a question on your sponsorship budget. Line item for sponsorship. What types of activities do you sponsor?
Our sponsorship budget is used for like self-governance.
I'm sorry, I can't hear you.
Our self-governance, yeah. Our sponsorship budget is used for like when we pay into self-governance, when we pay into the National Indian Health Board, when we pay into Southern Plain Tribal Health Board, when we sponsored the veterans, and then whenever we have sponsored like the scholarship programs. Most recently, we're getting ready to sponsor 2 health scholarships. We're trying to detail that out right now with the scholarship program here at the tribe.
Thank you, Mrs. Beaver. Are there other questions from the committee? Other questions from council online? Hearing none, when the committee is ready, I will entertain a motion.
Madam Chair, I make that motion, Robert Huft.
We have a motion on the floor from Representative Huft to approve this budget. Is there a second?
Second.
Second from Representative Gouge. Roll call vote, please.
Robert Huff,
Yes.
Mary Crawford, Anna Marshall, Leonard Gouch.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The Secretary of Health budget is approved. Next budget is the special diabetes program.
Okay, the special diabetes program has an IHS budget, a third-party budget, and then, of course, our large special diabetes grant. So what we have budgeted in the grant is the amount of that grant. The IHS, basically, we just moved all of the salaries into IHS and everything else went into third-party. That budget is pretty much the same as it was last year. I think maybe $40,000 difference.
Other questions for Ms. Crawford on this budget from the committee? Other questions from council online on this budget? Hearing none, when the committee is ready, I will entertain a motion.
Well, I have a question before.
Yes, Representative Marshall.
On your special diabetes program, are they the ones that do the summit and some of the walking program? Is that included in this special diabetes? Okay.
Is.
Madam Chair, I'll make a motion that we approve the special diabetes program.
We have a motion on the floor from Representative Marshall to approve this budget. Is there a second? Second from Representative Crawford. Roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouch,
Yes.
Robert Huff,
Yes.
Mary Crawford. Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The special diabetes program budget is approved. We are now on the specialty service management budget.
The specialty services is another new budget for this year. This is another one that is allocated back out. So with the number of specialty clinics that we have and services and trying to manage those over Okemo and Okmulgee and Tulsa, we have someone that's managing all of those different services and ensuring that we have people in all the right places and those contracts. So a lot of those are contracted providers. And I'd be happy to answer any questions on that one.
Thank you, Ms. Crawford. Are there questions from the committee on this budget? Any questions from council online? Hearing none, when the committee is ready, I will entertain a motion.
Madam Chair, I make a motion that we approve the specialty service management budget.
Okay, we have a motion on the floor from Representative Marshall. The second from Representative Crawford to approve this budget. Roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouch,
Yes.
Robert Huff,
Yes.
Mary Crawford. Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The specialty service management budget is approved. Down to the tobacco control and prevention budget.
Yes. The tobacco control and prevention, not really much change in this. This position does report up through behavioral health, but we've kept this one as a separate program because that's the way it was initially. I understand they're still trying to obtain grants for the tobacco prevention. Most of the cost of this is going to the schools. When I mentioned earlier the behavioral health grant, that grant is specifically for this, and the monies this year is being spent to purchase some workout equipment to go into the dorms. So I know we just processed those POs last week for a treadmill and some other equipment to go into the dorms for workout equipment for them. That's what those funds were being used for. And I'd be happy to answer any questions.
Are there questions for Ms. Crawford on this budget?
Yes. You just mentioned buying
Representative
some.
Marshall.
Oh, I'm sorry. Thank you, Madam Chair. On the treadmills that you said that you were, did I hear you correct?
Yes.
Okay. Where are those going to be at?
What I was told is they were going to be in the dorms.
Nowhere.
I'm assuming that's down. Yeah, do you follow dorms?
Oh, okay, okay. I know that before, so you just have one staff person that does the tobacco program? Because I remember that they used to, when there was a staff of, what was it, 3, that they were going out and they were going into the communities and doing educational things with elders, with community members, and all of that. And people appreciated that team that was going out, and they were, enthusiastic about tobacco control and things like that in prevention. And they worked in the schools and things like that. But so mainly now you're just focusing on schools.
I'm not going to say that he only goes to the schools. I just know about that part of it.
Oh, okay.
So this tobacco prevention was funded originally through the state, and the state pulled this grant out from underneath us all of a sudden with really no explanation. And so those staff moved into other areas of the Department of Health, and we kept Sprint inside that program so he could keep going that route. One of our goals with the public health program is a lot of these, what we would like to do is in all of these positions that goes out to the schools, to the communities, works with all of that. We want to standardize this and create what we're going to call public health educators, and that they can do a variety of topics, not just tobacco, but any kind of healthcare topic, and they'll work with all of it. So I think that this position will probably end up moving into public health, and he can focus on more than just tobacco. He'll be able to go into those communities and do any topic.
Okay. And then also, have you seen an increase in vaping with the high schoolers?
A lot, yeah. I suspect, and I'm just purely speculating, is that there's getting ready to be another class action lawsuit that, much like what happened with tobacco, is going to end up happening with this vaping. And you're seeing a lot of these healthcare issues popping up. But yes, lots of pulmonary issues that's popping up with kids that shouldn't be having pulmonary issues with this vaping. So we have seen it.
Thank you, Madam Chair. Thank you, Mr. Terry and Mrs. Crawford.
Thank you, Representative Marshall. Are there other questions on this budget from the committee? Yes, Representative Marshall. I'm sorry, Representative Crawford.
Mr. Terry, have you all evaluated or revisited the areas or are designated for smokers, like in our facilities, our clinics, our buildings here? As far as I know, they're talking a lot about the secondhand smoke, and does just as much harm. I was just kind of concerned about some of the areas where they are designated for smokers as being around the entrances to some of the buildings.
So I know the Department of Health, we have designated smoking areas that are away from the entrances of the building. I have not had that conversation on the tribal side of that. I'm happy to take that recommendation, though, and go talk to the nation and see if they would designate some smoking areas outside of those. But it is an issue.
Thank you, Madam Chair.
Thank you, Representative Crawford. Mr. Terry, I have a question. On that lawsuit that you mentioned a while ago about vaping, Would that be just for health facilities, or would that include these businesses that sell the vaping devices and products?
I think they will go after the manufacturers, is what I think will happen. I suspect it won't be the distributors. I think it'll be the manufacturers of it. And I think from everything that I've read, their focus is going to be on those companies that create more flavors that tend to be more marketable towards children. So you got different candy sort of flavors and so forth. And I think there's probably going to be a movement of trying to get rid of a lot of those types of flavors in the vaping. But once again, I'm just speculating from what I'm reading. That's where I see all of the debate happening at the federal level.
Thank you. Thank you, sir. Are there other questions for Mr. Terry or Ms. Crawford on this budget from the committee? Other questions from council online?
Yes, Madam Chair, it's Representative Harjo.
Representative Harjo, you have the floor.
Yeah, Mr. Terry, I've got a question, and you might be able to clarify this. I'm not, this is just something that I heard in past, and I don't really know how true it is, but it just seems like there's been a lot of things tested on different, different races at different times for whatever the manufacturers were deciding to sell. And from what I gather, and maybe I missed it, hopefully I didn't, that a lot of this was tested on the Native Americans to see whether or not if the different flavors would go of the vaping. And, so that way, once they tested it within the Native American community and it went well with them, then that's how they based what they were going to really sell out to the public as a whole. Is there any truth to that?
I've not read anything, Mr. Harjo, but I am a pretty good conspiracy theorist. And if you had to ask me if I believed it, I would say I would believe that they would go out and test it in some of these underserved areas. And absolutely, that's exactly what I would say as well. So I don't have any proof to that, but I wouldn't deny it either.
All right, well, thank you, sir.
Thank you.
Representative Harjo, are there any other questions?
No, ma'am. I was just want to ask that. That's just something that I heard, and I don't know. That's just something I had to ask. Thank you.
Okay, thank you, sir.
Madam Chair,
Yes, Representative Marshall.
I make a motion that we approve the tobacco control and prevention budget.
We have a motion on the floor to approve this budget. Is there a second?
Second.
Second from Representative Crawford. Roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouch,
Yes.
Robert Huff,
Yes.
Mary Crawford. Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The tobacco control and prevention budget is approved. Now we are at the vaccination program budget.
Vaccination program budget is primarily for the CNAs who are going through the LPN program. So we pay them, and they are required to work a certain number of hours per week while they're going to school. So they're paid under this. This was part of our IHS COVID funds that we are designating to replace staff that was lost during COVID and just to try to bring up more staff because of the shortage. And the reason why they're at a partial FTE is we've got some that are graduating in December And so, and then others will start out in January, so they're at partial FTEs for the year. I'd be happy to answer any questions about that.
Thank you, Ms. Crawford. Are there questions from the committee for Ms. Crawford on this budget? A question, did you lose a lot of staff during the COVID?
Did.
Did.
But there were some people that just decided they didn't want to do that anymore. And there were a lot of staff that went into traveling. What we've seen is a large increase in traveling nurses, contract nurses. And so that staff cost us a lot more money. So we're trying to bring up our own staff. And those that are interested in becoming LPNs can apply for that program.
Thank you. Are there other questions for Ms. Crawford on this budget? Other questions from council online on this budget? Hearing none, when the committee is ready, I will entertain a motion.
Madam Chair,
Yes, Representative Marshall.
I make a motion to approve the vaccination program.
We have a motion on the floor to approve this budget from Representative Marshall. Is there a second? Second by Representative Crawford. Roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouge,
Yes.
Robert Huff,
Yes.
Mary Crawford. Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The vaccination program budget is approved. We're down to our last budget, the Wetumpka Clinic budget.
This clinic budget has the lab and x-ray tech for the full year. We had added those during the year in '23. And so that's that plus the additional drug cost was the reason for the increase in this budget. Also, we had a change from an LPN to an RN in that clinic. Happy to answer any questions.
Please. Thank you, Ms. Crawford. Are there questions from the committee for Ms. Crawford on this budget?
Madam Chair, I have some questions.
Yes, Representative Marshall. You have the floor.
So how many staff the staff that you have listed for this proposed salary plan? Those are the ones that, are they currently going there now or will they be going there?
All of the staff is currently employed there now. It's just that we added the x-ray and the lab during the year, so the budget for '24 is for a full year, where in '23 it was for a partial year. So that was that part of increase, and then moving from an LPN to an RN. Actually, it was just, we didn't change the staff. The employee got her RN, and so that changed.
So is that open every day or is it just open certain days?
Open every day.
Every day from 8 to 5 or?
Through Friday, yes.
Monday through Friday, 8 to 5?
Yeah.
Okay. That's all the questions I have, Madam Chair.
Thank you, Representative Marshall. Are there any other questions from the committee on this budget? Are there any questions from council online on this budget? Hearing none, when the committee is ready, I will entertain a motion.
Madam Chair, I make a motion that we approve the Wetumpka Clinic budget.
We have a motion on the floor from Representative Marshall to approve this budget. Is there a second?
Second.
Second by Representative Crawford. Roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouge,
Yes.
Robert Huff,
Yes.
Mary Crawford.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The Wetumpka Clinic budget is approved. And now we are down to, and all the approved budgets will be forwarded to BF&J for funding. Do we have we're down to other business. Is there other business this committee needs to act on? Hearing none, are there announcements from this committee? The LNC budget is tonight at 6 o'clock. And I will take a motion for an adjournment.
So move.
We have a motion from Representative Marshall to adjourn. Is there a second? Representative Crawford seconded that motion. All in favor, say aye.
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 We are down to our benediction, and Representative Marshall, I will ask for a benediction from you, if you can stand, if you're able.
Let us pray. Creator God, we just thank you for this time together, and we just thank you for your guidance in getting us through the process of the budget. And we just ask that you continue to bless the work of our health workers and the health division, and that you just continue to give them wisdom and guidance as they go before our people and our citizens and as they serve them. And we just ask that you just continue to be with our nation as we move forward in the difficult and uncertain days ahead. And we just ask all these things in your name. Amen.
Thank you, Representative Marshall. We are adjourned at 11:29. 12:29.